Welcome to the Intelligent Change podcast. We're here with the one and only Boniface Verney-Carron.
Well done. We practiced this and you did well.
I'm really excited to have you as one of our first guests on Intelligent Change podcast. It's a new project that we're embarking on, as you know, with so many other projects. And it's really talking about the topic of creating intelligent change in your life. Mm-hmm. And we met in Ibiza last year, and there was so much that was drawn to intuitively to yourself in regards to how you help people create change in their life. Because I think so much of your work is based on that. But before we get into that, I'd be curious to know, how did you get into this type of work? And if you describe more of what is it that you do? Because you are by profession an osteopath.
That's
However, right. I think you're way beyond an osteopath. So please tell me more of your journey of getting to be a healer, a modern day healer.
Well, that's really sweet. It's funny you choose this word, and it's actually a conversation I have with my wife, because she thinks that too in a very kind way. And I think it's a very hard title for me, because a lot of what I'm trying to do, and I think I am an osteopath, and I think I'm beyond osteopathy. What I think I am is that I've opened osteopathy transversally to the way I'm practicing, but it's not a progression in terms of elevation. It's more a progression in terms of widening the spectrum of what I want to feel and address, but also suggest to the patients and people I'm lucky to be seeing. So how to answer your question first. So how did I got into this? It's a really funny moment for me, because I have a son who's 14, and I think we are blessed, and he is blessed especially, to have a vocation. So he knows what he wants to do, and if we look back, he's been this way all along. He wants to design stuff and make stuff, and he does it with such passion. And I think in a similar way, I grew up knowing that I was going to be, let's call it a doctor for now. I was going to help people in that way, in the medicine field. And as far as I can remember, as far as my family remembers, my parents, that's what I wanted to do. So I guess I could just answer, I was drawn to it from, I wouldn't call it birth, but as far as I can remember, that I wanted to do something, and this is the thing I wanted to do. Now, the way it has shaped over the years definitely has surprised me mostly, and probably even the people that are around me. But to make a long story short, I think what was interesting is that when I became an osteopath, which was a very alternative way of looking at medicine in general, and we're talking here in years 2000, early 2000, it was still, to say it, illegal to practice osteopathy in France. So just to give you a bit of a timeline here, it only became legal in 2005. So I started in 2000 after having studied medicine for 2 years and then switching to osteopathy. And this was really a call from the freedom that I've got from my parents, who are very free-minded people. And it was a big deal to go into a place where technically you were not really going to be recognized by, society. And that also gave an amazing strength and passion and drive, because the people that were teaching us were in a way practicing an illegal way of medicine as such, so they had to be good. There was no way, there would be no excuse for them, and they carried a lot of accountability in their work and in their passing of knowledge. So I think that in a very fortunate way, I landed in this osteopathic world, which in the 2000 in France was like, let's say, holistic approach of medicine in general. It wasn't just osteopathy. And we were drawn to understand nutrition, to understand the microbiome, to understand things that today are in everyone's language. But trust me, 25 years ago, no one really spoke about this. So I would say that we were in contact constantly with pioneers in their field. And when you're in contact with pioneers in any field, I guess, but in this field in particular, you feel totally elevated, for that matter, because the passion is here. So you just want to be, wow, I'm feeling this. There's an energy around these people. And if anything, there's a real courage to be able to do this. You have to. And I think somehow this passed on. And I was lucky to come to England to study my last 2 years of osteopathy here.
Was it legal then?
It was illegal in England, so this is
Oh.
why I came. This is the whole story. I ended up in Maidstone. It's called the European School of Osteopathy, to name it, and it was the most diverse way of doing this job and the most wholesome, and it was really quite extraordinary. And I was lucky that I could speak English at the time, so the transition wasn't too difficult. Obviously, I had to learn all the semantics of pathologies and stuff in English, but this transition was okay, and it was just fascinating to understand what it would be for a patient to feel ill, which was very different from me putting a diagnosis, just listening to symptoms. It's like we can think about why. Why is someone, if you think about, let's say, flu, right? You're going to have flu everywhere in the city. Not everyone gets the flu. So why do certain people get overwhelmed by a certain virus, bacteria, parasite, whatever it is? What is the immune system? What is the strength in the immune system? Where can we feed it? Where can we know there's a crack? All these kind of upstream thoughts that you can keep bringing if you start going away and de-zooming from the symptoms. Of course, you want to make sure your patient's not going to die on the table, so you got to make sure they're safe. But when they're safe and they're going to live, let's just get the symptoms on the side for a little bit and just stretch out and see them as a person. And that means who they are right now, where they come from, what's their culture, their social-cultural background. We could talk about the cultural differences in how people approach medicine and therefore their own health. I've had a fascinating 20 years in London where I see patients from such different cultural backgrounds. And trust me, even if someone comes with shoulder pain, let's say, it's a 50-year-old Japanese man, a 48-year-old Italian man, or let's say a 35-year-old English man, they have no expectations that will match in how their symptoms should go, how the treatment should go, how it's incredible. So we could even here talk about the cultural aspect of health, which we never really talk about. And all these things came to me and I was like, wow, the more I was learning, the more my patients were teaching me, the more the spectrum just broadened to pretty much infinity. And I was like, really what I need to do is to be able to feel, have an instinctive side to feel what's going on, obviously apply some frame of knowledge that you learn about anatomy, physiology, pathology, of course, and then allow in the treatment. And this is something I'm so thankful to osteopathy and acupuncture, because that's what I also practiced later on, is that there's a side of it all that is very technical and very tangible and very rational. And in the same moment, and I mean that in the same moment, you can just switch in your mind with intention, with life force, with things that you feel that are, to say it, in the invisible world. I'm not getting all woohoo here with everyone. I'm just saying that it's an interesting, the dichotomy of where your mindset brings your power to do something that we could resume in terms of intention, let's say, is quite extraordinary when you are in presence of another human being who wants to get better. Because it's quite rare that people come and don't want to get better. There are cases, actually, we can talk about. It's quite funny. Some people like to be sick because it gives them
meaning
for others. Exactly, But putting these people aside, most people want to get better. So the deep core intention of their soul is to get better. The deep core intention of their body, physiology and metabolism, is to get better, because that's what our body do. They keep regenerating and healing. So when you match this force inside you, your intention to help, your instinct, their inner power to heal, then that's where you can start to make changes that are, for lack of a better word, surprising. And also where that takes you is surprising, because it's a lot, and we had quite a quick chat about this, but when people come in, obviously I'm an osteopath, there's expectations. Is it my low back? Is it my neck? They come for more mechanical things. A bit less and less now as time passes, and I've been doing this for 20 years, but they do still come in. And then something else happens, and something else starts to, is it? And I will just question. And this is an invitation. It's a suggestion about you. I sense this, you tell me this, and your body tells us that. Okay, 3 stages in which things match sometimes, and sometimes not so much. And in that kind of mild discrepancy, will you find a crack that you can slowly get in, and there is the entrance to a much wider, deeper sense of dysfunction or trauma, and that's where people can be surprised by, oh, I came to see this guy because, well, this and that was going to me, and then like, but he asked me about my childhood and why did I do this job, and am I happy in my marriage, and what's going on with my third kid, or, you know, all this, I guess, questions that are or seem totally irrelevant, but actually will totally bring a picture of what health is to this person right now. And this is the thing, is to remember health is a lot more, has many more layers, and it's the physicality of it, of course, the body, the mental health, which is obviously a lot more on the scene right now, which is great, people are acknowledging it. And the third pillar, which I'm very keen on, is the social well-being side of health. We are social animals, and a lot of people here, I'm sure, have read *Sapiens* from Harari, or *Humankind* for Bregman. You know, we have now anthropology and sociology coming into the mainstream knowledge, which I think is extraordinary, because it's probably my most passionate subject when I bring it back to understand people's behavior and health. But you realize that the social well-being is an extraordinary and vast topic in which you understand posture, you understand, because posture is nothing else than the expression of your nonverbal communication. You understand your reception, you understand, I mean, I could go forever here. And you realize, hang on a minute, have we missed out on this? Have we not really understood what our exposure to our social setting will mean to us, and how will this affect my mental health? How will this affect my physical health, and so forth? And having this option presented to people is a bit more, I'm just suddenly just, what about that? So I'm just putting a mirror facing back to them, saying, with a little title at the top, social well-being, tell me about this. How do you feel socially? I'm fine. Okay. Tell me about your friends. How deep in conversation about your intimate feelings can you go with your friends? Okay. Maybe not that many. Okay. Why? What are we, you understand what I'm going with? So you can very quickly unveil what seems to be a social shield, I will call it, where people just act, because we're all acting, right? We're all dressed, we put perfume, I'm playing the doctor here, we're all acting, you're acting the interview, and it's great, but it is a game, right? Which I like when you say this. We are playing, and we have to keep playing the game. And I'm not saying this in a pejorative way. I think it's a good game we're playing. We're lucky, but it is a game. And then suddenly, no game. Okay, so who are you, Alex? Why are you here? What's the, so we talked about this again before. People. So who are you as a human? Who are the people around you that some you chose, some you didn't? Places. Why are you here? How did you choose your connection to the place where you wanted to be and live? Why did you choose that piece of earth? Power. How do you feel empowered into this place? Do you feel that you are free? Do you feel that you can say, think, act the way you feel you should, or you need, or the planet needs you to do? Do you have a good coherence between your instinct and your everyday behavior? And finally, purpose. What is this all about? Why are we sitting this together? Why are we doing this now? Are we trying to change the world? Are we trying to change a few people? And I've heard you say, and I concur, if one thing changes in the people around us, or looking at this, or listening to this, well, we've won. This was it. There's no more goal than that. And if we're just here to play game more and play ball and have a lovely conversation and have fun, that's plenty enough for me too. So it's where are our expectations with our purpose? And that's something that I'm not trying to be all philosophical here. I'm just saying that all this comes into one wrap, which we called belonging as well, to a place, belonging to a group, belonging to a community, belonging to, and we keep asking you to belong. You're in a country, you are in a religion, you're in this, we keep trying, before you even understand this concept, we have already stamped you with all these things. And then you have to make sense of it. I don't know, I was born in Lyon, France, so technically a Catholic country, right? Even though my parents were not so religious, but of course I've been to church many times for weddings, for funerals, for, it's because it's cultural. But when you ask me, oh, do you want to do a bit of what we call catechism, learning about, in this instance, the Catholic religion, and do you believe in God? Well, now that's a very good question. Do I believe in God? Yeah, if you ask me at 8 or 9, I would say, yes, why not? I've been told to believe in God. There's a God, apparently. There's Jesus, all that. Yeah, sure. 15, 14, 16, then you ask the question, God, but what does he do? What is God doing about cancer in children? Why do you have a 4-year-old friend who, what is that God's doing? Is that because, I'm obviously taking a really awful example here, but things like that. And I'm like, not that I'm an atheist, and obviously from what I've just explained, I'm quite connected to the invisible, or let's say not yet tangible space. Like there's a space between us that we can't technically hold, but it's really there, and we've just charged it with your intention, my intention, our energy. It's not, we can't just say that this space right here is the same as this space right here, because it's not. And we know this, both of us. But what is it filled with? That's the question we can ask. Sorry, this was a very long answer, wasn't it? My God, I stop talking.
No, I love it. That's why, the whole reason why you're here. It's to really get this conversation. And what we're saying is, a lot of times people may think, okay, we're having you on. I'm personally new to, I'll say, this concept of osteopathy. Mm-hmm. I think what you're speaking about is so much beyond. Mm-hmm. So I think I'd love for you to unpack in a way of, because people may sometimes listen to this interview and be like, great, I'm going to go to my osteopath and I'm going to have this whole human experience that I think you take to your patients that come to you for obviously trying to unblock certain things. But what is that simple definition of osteopathy, and how is it different from a chiropractor, things like that? And you are sometimes referred to as a holistic kind of health leader. And what is, in a way, what I think we've described is what it is. But I'm curious if you can describe the kind of traditional osteopathy that came from this illegal practice to now being accepted, which at times seems very woo-woo as well, but has potential to actually solve problems.
Well, thank you for this question. I as you can just see, I like talking. I'm not very good at being short, so I'm going to try and make a definition. I should know there is a definition to osteopathy, of course, but I will say this. It's a manual therapy, meaning that you use your hands, and now I want to extend, you use a lot more than your hands, because you use all your senses to diagnose a somatic dysfunction. So let's explain those words, because this is interesting. So from Greek, soma is the body. You've heard about psychosomatic lesions. You say soma, so it's one psyche to the soma. Soma is the body. So a somatic dysfunction means that if you look at someone, structurally, nothing is broken. So the bones integrity respected, all the organs are where they should be, everything is where and how it should be, yet that person, that human in front of you, is experiencing a level of discomfort or dysfunction, right? He can't digest properly, he has a headache, sleeping is difficult, they have anxiety, they have constipation, and so forth. Now, if there's nothing broken as such, right? So we have to exclude what we call structural issues. That is for hospitals. You break your arm, you're not going to come see me. I don't want to see you, you don't want to see me. That's how, well, you want to go to a hospital where I'm going to give you treatment to fix the structure. Does that make sense? Same for a huge functional problem. You have a heart attack, you're not coming to an osteopath, right? So we exclude all this. Now, when we're in the realm of functional disorder, and there's a nice way to look at it here. If you think about ease, as in a nice position to be and feel, you have dis with an hyphen ease, which is the functional world, and then you have disease. You're actually ill. So our realm as osteopath, but also holistic practitioners in general, is to be in this realm of functional disorders, which if we do not treat, will lead to disease. So we're here. And it means what? It means that we're looking at the biomechanics, to make it simple, the muscles and ligaments and tendons and how the structure works together. Again, it's not broken, but it's not functioning well. 2, we look at circulation, which is I think one of the essential rules, there's 4 principles to osteopathy, and one is this: the rule of the artery is supreme. It means the circulation, which, if you think of it, means movement, is essential to life. And if anyone doubts this, if I stop your heart in 6 minutes, you're not there. So clearly, if the pump is not pumping, we don't have a lot of time on this planet, right? So we need blood to move constantly. We need oxygen to be exchanged in your lungs, on your red blood cells, given to your cells to do cellular respiration, blah, blah, blah. You need movement. So life as we know it, I'm sure there's many other shapes of life somewhere, but life as we know it on this planet is defined by movement. Everything in you moves. In this, nothing moves. It vibrates, but there's no movement and no exchange. In you, it's a constant exchange and movement. So movement is essential, circulation. Then we think, of course, of digestion, which is the extraction from our environment of what we need as nutrients. And this is it's a big topic because it's quite a complex system. I'm just making it simple here. The nervous system. So the nervous system is not just the command, it's also how do I extract now information from this outside world? What do I feel? What do I sense? How do I process it? And then how do I create a narrative of my reality? Right? Because if you think of it, and you've heard this many times, what I see now, what I'm talking about, what you are looking at and hearing, you're making it in your brain, and it's just little neurons doing with one another, right? What's real of it is the creative narration of in your own mind and head. And that also has been, as much as we don't think so, but it's been totally conditioned by what I've told you. You know that this is green and sage because I've told you this is green and sage, right? You've accepted it. If I had told you all your life this is red, you would tell me this is red, right? It doesn't mean that it doesn't change the color of it. It just changes the definition and how you define things around you. So coming back to cultural issues, it's really interesting to see how people have been conditioned to believe certain things and